your body's your temple, and you need to listen to
Mhm.
your body. And
Mm.
when you go to the right practitioners, they will give you the answers that you're looking for. My name is Jeff Mulvena. I am the host of Undiluted. I am here with my co-host, Dr. James Ferraro. This is the first podcast. This podcast is going to be called Undiluted: The Role of Healthcare in the USA. So I'm going to introduce again my co-host, Dr. James Ferraro. He is a chiropractor in Wilmington, Delaware. I believe we have a lot of the same values and beliefs in holistic medicine practices. And so basically, this podcast will be dedicated to helping people live healthier lifestyles. So, Dr. James, I appreciate you again for taking this opportunity with me. And so, could you just introduce yourself and what your background is and how long you've been doing chiropractic for?
Sure, Jeff. I love that we're doing this podcast. This is great stuff. One of my missions for people is to help them have a life without fear or reduced fear, because there's a lot of fear when it comes to health and illness. And some of that fear is because they don't feel empowered. Sounds a little new agey, but they don't feel that their body has the ability to heal itself. And it does. For the most part, the body is self-healing and self-regulating, and the magic happens from within. I believe that's our God-given innate ability to heal, and then we have that blessing, and then to kind of like, sometimes I think Western medicine kind of pushes that to the side and looks at like the disease process of like something's out there is going to get us, so to speak. So a little bit of my history. I was a high school football player, meaning I was a kicker and a punter. Wasn't the big guy back then. But I was good at what I did, and I threw my back out one time, and I had sciatica down my leg. So for about a year, maybe a little over a year, I suffered. I went to physical therapists. I went to medical doctors, like orthopedic surgeon guys, and more physical therapy. No relief at all. Nothing helped. Went to the doctor that was the team physician for the New York Giants. So I'm thinking, here's the man. He's going to help. Get a CAT scan. This is so long ago, they didn't have MRIs back then. And the CAT scan showed like a disc bulge, not herniation, but bulge. And I keep on doing physical therapy, but nothing was helping me. So my next door neighbor, who's like my age, just about, says, "Why don't you try a chiropractor?" So he's a layperson telling me, I'm like, I don't know about that. So I go, and like three, four visits, I'm like 75, 80% better. Yeah. So, and nothing helped me up until that point. So I'm like, wow, this works. And the doctor had the x-rays, and he showed, hey, listen, this is the chiropractor. He said, you're biomechanically imbalanced. Your hips are off. You're rotated. And I'm thinking to myself, how come nobody else said this to me? It's a different approach to healthcare. Whole structure affects function. So that ignited a passion and a fire for like wellness care, because there was no drugs, no injections, no surgery. And I got a phenomenal result. And then, I got a little more academic confidence because I was a lazy high school student when it came to the books.
No,
And then
you
in
can never
college, I
be
just,
lazy. You can never be
what's that?
lazy. You can
I'm
never be
sorry.
lazy. You can
Yeah.
never be lazy.
I don't know, but I'll tell you what. So like once I got to college, and I realized like, okay, this is what I want to do. Then like, the C's turned into A's because I actually wanted to study. So one of those things. So I do believe, a little side note, that if you're passionate about something, it's much easier to learn it than if you're not. So, fast forward, I've been in practice for over 30 years. So I'm in Trolley Square in Wilmington, Delaware, in private practice, and I'm loving it. And the best thing about practice is obviously getting results with patients, but it's that, in conjunction with that, it's that patient interaction where you have that rapport. So you learn about people's lives. It's not just about pain management.
And helping
So
the
that should be,
community.
yes, 100%. And we're big on that. Like, okay, community, like I want to inspire, motivate, and educate people on chiropractic and wellness care. And it doesn't have to be this office. It can be someone can be. I had a patient transfer to like Texas. Go get a chiropractor, like do your thing, because they're helping themselves, but then we're planting a seed where they can educate other people. Like they're getting results. They're living a usually a different lifestyle, a little more wellness oriented, and then people look at results. You go to the gym and you see people that are in really good shapes. You're more apt to ask that guy a question like, what are you doing to get there? That kind of thing. I get excited about that.
Yeah, I do too, because, again, like you've already mentioned, Western medicine isn't everything, right? It's definitely a necessity, but in other ways, we can learn ways to how our body can really heal itself, like you said. And
Yep.
that could be, through diet, exercise, maybe changing a little things in your diet that you normally, wouldn't really notice, maybe cutting seed oils out of your diet, or inflammatory foods or drinks, sodas, maybe coffee, inflammation, the caffeine. We could go on and on about this. So that's why it's so important that we're making known that holistic practices are really important, and these can change our little everyday things in our life. So, a little bit about me. Again, my name is Jeff Mulvena. I'm a registered nurse. My background is in ICU. I've done a little bit of management. I've also done some travel nursing, but I'm now making the next chapter of my career as a holistic nurse coach. So, what is holistic nurse coaching? So, the holistic nurse coach is a registered nurse who integrates coaching competencies into any setting or specialty area of practice to facilitate a process of change or development that assists individuals or groups to realize their potential using the mind, body, and spirit. Nurse coaching is a skilled, purposeful, results oriented, and structured relationship centered interaction with clients provided by registered nurses for the purpose of promoting achievement of client goals. So the reason why we're naming this podcast Undiluted is that we want to really give you the raw, in knowing that we want to give you the information that people need to live healthy lifestyles. Um, not taking life for granted, not giving up. If you're, really struggling with, disease management, or, you need help with changing daily habits, that's what a nurse coach is here to do. Um, I can help you focus on anything pertaining to your life. We can focus on something as little as, going to the gym, or you want to make a change in terms of your relationship with people in your life, such as friends or family. So the results are endless. So basically, right now, I want to talk more about Dr. James with you. What is it that you have seen in your career, um, you've been able to do to help people, and how that it's able to change your life for the better?
Hmm. I think the pattern I see, especially more recently, I see the more I can reduce physical tension in a person's body, the better. So Donnie Epstein used to talk about that, or still does talk about this. Three types of stress. We have physical, chemical, and emotional stress. Most of the stuff we recover from. You have a bad meal, your body digests it, liver, kidneys process it, and excrete the toxins out. Some people get stuck though. I have a bad car accident. It's a physical. You're physically stuck. Death of a loved one. Sometimes you get emotionally stuck. Chemical stress. Let's just say overuse of like medications or toxins or too much drinking. That could be a chemical stress tone that's stored in the system. So there's these physiologic tensions that are stored in people's bodies or systems, and specifically the nerve system, that I see and I feel like the best healing or the best work I can do on them is to reduce those tensions and educate them on how to do that. So there's different ways of doing that, but my main thing is through chiropractic care is to reduce that tension through adjustments, which reduces the physical tone in the body, but then maybe teach them breathing exercises or some meditation or give them some nutritional tips. And then I get them on the way. I'm not the answer to all their stuff, but if I can be kind of that traffic cop, this is what I do. The forte of what I do is restoration of joint function and reduce nerve interference. That's what I do. And if it's outside my wheelhouse, um, go see a nutritionist, go see a health coach, go join, get a yoga class or Pilates, something that you kind of resonate with, that you can at least get started. I always say like progress, not perfection. You don't have to like be perfect. Just as long as you're on that
You
path.
know what I like better than perfect?
What's that?
I like simplicity.
There you go. Yeah. Keep it simple, right? Yeah. Amen to that. So I'm excited about that. What lights your fire about about healthcare and wellness?
Yeah, I mean, I got into this to help people, right?
Right.
I love the body. I love anatomy, physiology. I love how, patients come into the hospital, how we can treat them to hopefully to keep them surviving and, hopefully walk out of the hospital. That's all everyone's intention is to have a good positive outcome.
Right.
When I became a nurse, I really wanted to dive deep into the mind, body, and spirit, but that wasn't until now. So I really feel like I have a good foundation of helping people from the whole perspective. So I've learned all that. What we see in healthcare in America is a lot of people, low socioeconomic backgrounds and elderly populations coming into the hospital frequently,
Mm,
many for the same reasons. So, like you said, in terms of, if you're not sure about how someone should go about with their disease management or chronic conditions, go see a health coach or go see your doctor or go see a chiropractor, right? I think a lot of it we need to do more in the community is focus on prevention
yep.
and preventing people from their lifestyles getting too out of hand, whether that's smoking cigarettes, drinking alcohol, doing drugs, um, eating fast food continuously, eating out every day. A lot of this should
Mm,
be eating at home, going to the grocery store, going for a run, going for a walk, eating healthy, eating healthy, right? Like a lot of vegetables, fruit, fiber, getting in touch with your mind, body, and spirit. I mean, a lot of these things are red flags that come in, right? And that's why a client or a patient will come to see someone because they're dealing with some sort of ailment, and that needs to be addressed. So getting more in touch with yourself is so important because everybody needs everyone. Everyone needs their mother. Everyone needs their father. Someone needs their grandfather, their grandmother. We all thrive when the community is doing well, and we can give back to our economy and really, create, more better infrastructure. People that are doing good. People that are helping everyone, in the community. So that's all. So it's all about positivity.
yeah, it's important. I think getting back to what we were just talking about, I feel like if when you give patients the tools to help themselves and they start realizing that it works, it reduces their fear and it improves their confidence and their self-esteem. And it gives them momentum. Like, wait a minute, I can do something about my pain or symptoms or condition, or I feel pretty good, but I can feel better, or I can maybe live longer because I'm putting less toxins in my body, whatever it may be. So I get really inspired about that. And I know that this is truth because the body truly is self-healing and self-regulating. And I think, with all, when we had this epidemic that was going on with COVID, it it was pretty scary. And COVID's a legit real virus. But I'm not all about vaccines. I'm a centrist, but a little more of an anti-vaxxer than the average guy out there because I realize and I know that the vaccines have caused a lot of problems from blood clots to heart disease to infertility. I don't know what the stats are. I mean, there's a wide variation as far as the stats on the side effects from the vaccination, some lethal, but they all agree now that there has been some surprising side effects. Uh, so I'm laying kind of a controversial foundation. But my whole point is, a lot of people chose to get vaccinated because they were scared, and nobody was talking about. I've been saying this for 5 years now. Nobody's talking about the body heals itself. Like, listen, the virus is legit, but like, why don't you focus on strengthening your immune system? Why don't you get enough sleep, reduce your stress? Okay, you want to wear the mask, that's fine. But guess what? Build your immunity because no matter what, your immune system's going to fight whatever you get exposed to. And I think we all were getting exposed to it, wearing a mask or not. We were. So, it's a great micro example of my belief system. I'm not saying I'm right, everyone else is wrong. I'm just saying this is what I believe based on observation, not just like reading books. So I
Yeah,
saw
and
it
I'll
in my
add to that. I
practice.
think I think vaccines are important. But it's very specific to which vaccine we're talking about.
Yes.
If we're talking about I don't know, tetanus shot, Tdap, or some very old like polio. Those are vaccines we've shown to have good outcomes. But during COVID, my firsthand experience working in COVID ICU, absolutely, there was a lot of fear in the media. I think the media is what really caused a lot of controversy and people wanting to get the vaccine, being one myself, thinking that I would be protected. So I think a lot of it has to do with knowing what you're putting in your body. As a patient, you should be really, really focused on that and do your own research. And so, I did my own research. I knew going in that the COVID vaccine, it was emergency. It was emergent that the vaccine was, had to, be rolled out quickly. In terms of my job, I had to get it. So I didn't really have a choice in the matter, but I
Right.
felt confident. I felt confident I'd be okay. Well, after my second shot and the booster, I quickly learned that there was issues going on with my stomach that normally never happened to
Mm-hmm.
me. And so after the second shot, I started getting shooting pains in my right upper quadrant, and I
Mm-hmm.
didn't really recognize what was going on with me at that time. And it
Mm-hmm.
wasn't later on until I got the booster and I started having really bad pains. And I had to go to the hospital about 2 times within 1 month at one hospital that I was traveling at, and then another time at another nursing travel assignment that I had to do. So during this whole time, I wasn't really sure what was happening to me because I had all the tests done. I had a CT scan, ultrasound. Nothing showed preliminary except for my amylase and lipase being elevated, meaning my pancreas was showing inflammation, which is not, normal. The amylase and lipase should be normal breaking down proteins, but I was having a lot of bloating. I changed my
Mm-hmm.
diet considerably and was starting to work out, really understanding what I was putting in my body. But during that time, doctors prescribed me Prilosec. Prilosec is a
Mm-hmm.
PPI, a proton pump inhibitor.
Mm-hmm.
And so at the time, that kind of put a Band-Aid on the situation because I wasn't having any bloating. I was moving my bowels. I wasn't having much complications. So after more research, I realized that being on a PPI long term is not ideal. Being on a
Mm-hmm.
PPI greater than 12 months actually has indications of dementia. There's research that shows that
Mm-hmm.
44% of patients actually can develop dementia being on a PPI too long. So I realized that I didn't want to be on a medication like that if in terms of my gut and maybe there's an underlying problem. So I started seeing my gastroenterologist, and I'll be clear and set the record straight that I believe everyone has helped me in this journey. So every doctor that I've worked with, they've given me great care. So there's no doubt about that. But I realized after I had my first colonoscopy that they did a biopsy and they found microscopic colitis.
Mm,
Microscopic colitis, PPIs are not indicated for that. It actually makes the disease process worse. So I was stopped off that. I weaned myself slowly with the approval of my doctor.
mm,
And I started to feel better. I stopped drinking caffeine. I started eating whole foods, but I still was dealing with the bloating.
mm,
I started to see a Chinese herbalist, and they were great. I was getting Chinese herbs, and I was doing acupuncture. Basically, I was taking herbs every day for about a couple months, and then acupuncture once a month. And I got
mm,
results from that, but not enough. So it wasn't until recently, I've been dealing with this issue for about 2 years. I saw my GI doctor, and I was
mm,
adamant about going on budesonide. Budesonide inhalation form is for COPD patients who struggle with inflammation in their lungs, but budesonide orally is first line treatment for microscopic colitis. So
mm,
before I did that intervention, I realized I wanted to try one more holistic method. And I found this chiropractor online by the name of Dr. Ruscio, Ruscio. And
mm,
I found his research, which was very in depth. And I found out that his supplements were treated for microscopic colitis. So I gave it a shot. So I got his basically his amino acid, vitamin, mineral supplement,
mm,
and he suggests going on a 4 day fast, but I only did it for one day. That's as much as I could
mm.
tolerate it. But
Right.
almost instantaneously, my bloating was gone and my bowel patterns were back to being regular.
Mm,
So he suggested after that doing a diet that works best for you. Most Americans who eat a Western American diet um, do well on paleo. I just pretty much did whole foods, a lot of meat,
mm,
minimal carbs, chicken, fruits, vegetables, really no bread, nothing processed,
mm.
absolutely not.
Yep. Yep.
So since then, I am 100% back to myself. Thank God.
That's awesome.
Um, but it wasn't for the help of everybody that, I came along the way and asking the right questions and what I knew to do for myself. So that's really important that patients or clients, people out in the world understand that, your body's your temple and you need to listen to
Mm,
your body. And
mm,
when you go to the right practitioners, they will give you the answers that you're looking for. And so
mm,
being healthy, number one, like you said, instead of taking the vaccine, if you don't believe that's right for you, maybe make other changes so that you feel that your immune system is adequate enough to combat a virus or a disease. And that's the point of this is that prevention is everything. If you can be prevented from something long term, then yeah, I mean that's the point of this. We want everybody to be healthy and thrive. So yeah, that's my gist of it.
mm. I love it. I love it. And that's a great story too, because you persevered. You didn't just stop at one doc and say, well, I guess I'll just resign myself to these symptoms which you suffered. But you just like said, because I think maybe that's indicative of there's a deep down like faith that, hey, if I keep on pursuing, I will find the solution to this. And it just can't be that there's a med, there's other factors. So how do you get your homeostatic mechanism back in balance? That's part of what the one chiropractor was. Ruscio, is that his name?
Russia.
That's
Yep.
yeah, awesome. I love that stuff too. And by the way, when I hear patients talk about like this story here that you just had, Jeff, it's great because that educates me. Because I know in practice, I do not know it all and not even close. Not even close. So every day, if I'm paying attention and I'm willing to learn, I learn from every single patient that comes in the door. And sometimes they'll come in with a odd disease, especially something that's uh, genetically traceable that I don't know about. And like, well, tell it. It's like, and I'll just say, I don't know. I'll look it up. I'll research it. but right now you probably know much more about this process than I do. And then, so let's work with that. Let me educate myself. In the interim, let me clear your spine. Let me remove your nerve interference. Let me restore biomechanical balance and restore joint function. I'll help your body work better. So no matter what you have, it's going to at least help your body be healthier. And that's the beauty of it. So I don't feel responsible to like eliminate somebody's disease process. Of course, I want to like have them feeling better, get them out of pain, or like with a specific health condition you had, you want to help the person. But like my foundational approach is clear the nerve system, clear the interference, and help the nerve system function better because the body's what? Self-healing, self-regulating, and that energy and that flow, even though it's in that life force is in every cell of the body, the life force, the energy system, the hard drive, the computer is your nerve system, brain, spinal cord, and all the peripheral nerves that come out, controls and coordinates the whole body. So that makes me like a clean burn. Like, okay, this is my focus. This is my job. And if I need some help with coaching a patient, I'll call you. Like, this patient needs some help. Or if somebody has, let's just say, trouble relaxing at night, I give them some videos, like as far as like, exercises for, uh, let's just say breathing exercise. One of the things I prescribe often is the 4-7-8 breathing, which is really helpful as far as teaching, well, first of all, relaxing the nerve system, but it also teaches the patient, hey, they can do this anytime, pretty much anywhere, maybe except when they're driving, to just chill their system, because most people are in that kind of semi-fight or flight state where their
The sympathetic
sympathetic
nervous
nervous,
system. Yep,
yeah,
exactly.
part of that. So autonomic nervous system, for the audience, is a system that is run pretty much without you thinking, whether it's your heartbeat or your digestion, etc. So, but you can change it. So most people, there's two parts to that autonomic: sympathetic and parasympathetic. Parasympathetic is more the relaxed state, the sleep state. Sympathetic is more that like fight or flight state, like when it's really jacked up. So, and neither one's bad. They're both functional. But if you're in that sympathetic state for too long a period of time, it's like this slow wear on your body and your energy, and of course your adrenals. So I see that with people. So that's a way I can help people. So so like I think a lot of times I call myself like the traffic cop. I'm doing my thing, but like I see other things, and then if they're open to suggestions, I can kind of send them in other areas. And we do a lot in this office. We have a massage therapist, we have a certified personal trainer, and so that we're doing things in here, but we may not have all the answers. At least it's a good starting point. So when you're coaching clients, you call them clients or patients?
Clients, call them clients.
Yeah, clients, exactly. A
Yeah.
little more wellness oriented. When you're coaching clients, do you have a foundational approach that you start with?
Yeah. So before every session, I really make sure we're both grounded. So we'll do some
Yep.
little meditation or guided imagery.
Mm,
So like you said,
mm-hmm,
we really relax that sympathetic nervous system. Um,
mm-hmm,
I feel like a lot of that has to do with what's going on in our day to day. And,
mm-hmm.
it's a
Right.
lot of constant going for everyone. So
Sure.
getting into a centered space where we feel like we're both calm and ready to start, we can really open our mind to new possibilities.
Mm-hmm,
So I think it's so important now because a lot of what the reason why I got into nursing was to basically help people one on one. I mean, ideally, that's what every nurse would like to do. And so that's the premise of what nursing is. We want to prevent people from getting sick and dying and
mm-hmm,
being cognizant of what they're doing with themselves in their environment, in their body, their stress, their work, everything. That all takes into account. I feel like you just touched on it, like the stress and the adrenals. I mean, it wears and tears on your body. I mean, if you don't address that, I mean, it will come to fruition in other ways.
Yeah.
Cancer, I mean, gaining weight, obesity, there's going to be an outlet for that if it's not addressed. And
Mhm.
so I'm such a big believer in that, and that everyone, like myself and you, only I know what's best for Jeff Molina, and only Dr. James knows what's best for Dr. James self. And if you or I don't know the answers, we seek that information and try to find it for ourselves. And I really believe that a lot of clients and patients have the power to make a difference in changing something in order to live a healthier life. And so whatever that is, I mean, working out, prayer, meditation,
Mhm.
seeing a chiropractor. I love going to your office because I feel like I'm super relaxed. Like I'm just like
Mhm.
I'm in Zen. So whatever that is for people, it's really important
Mhm.
you address that because you have to come first before anything else. And a lot of that is pushed to the side in our society in the United
Mhm.
States. It's very money hungry, and we have to
Mhm.
keep up. So I think it's just a different
Yeah.
mentality.
So, it's great that you're talking about like society and like and then money hungry because if you really if you step back and think about how important health is, you can take a billionaire, um, and then if he's lost his health, he'll give every dime to get his health back. You think because he can make the money back. So and then when you really like if you just like think about that and kind of let it like kind of simmer in your head, you're like, that's so logical. I go to the gym 3 days a week. I ran into this guy and I loved what he said. He said, 1 hour out of 24 is only 4%. I'm like, okay, so you got 1 hour to invest in your health every day. He's talking about going to the gym, but he's making a point. Like, what's your priority? Your priority is to make more money, or is your priority to, which is okay, but is that consuming you, where all this other stuff is on the back burner? So, and sometimes, and it's okay if someone's not doing it. I think sometimes you can get caught up in the hamster wheel and then forget that, like, oh shoot, I'm a little out of balance here, or I'm forgetting about taking care of that, or it might, whether it's my health or calling your mom or like what, things that I think are important. But I try not to like impose my belief system too much on people. This is what I believe, and here's why I believe it. Kind of like a Socratic method of thinking. So, but it's I feel like it's true. It's to me, it's logical. Like if you can have all the money in the world, but if you don't have your health, then okay, everyone else is going to be enjoying their inheritance. And then, so I think it's just a smart and wise thing to invest in and to explore. So when I see patients that come in and they get in like a wellness care package, or they get a monthly massage, or they get acupuncture, or they see a nutritionist, they have a personal trainer, I'm like, good for you. You're investing in your health. Whether they're doing it in my office or somewhere else, I love to see that because it's exciting. And that's a person that's being proactive. They're like, all right, I'm going to do something about this instead of just, and then, and that's a great approach. Now you can also, and this is where I'm going to get on my bandwagon a little bit. There's a lot of our society is about symptom care. You have back pain, you take a pill. You have a headache, you know, take a pill. You have tendonitis, you get an injection or take a pill. You have a runny nose, you take some Advil cold and sinus, or maybe you get some antibiotics. So and everything has its place. Antibiotics, as you know, in some cases save lives. So they're good. I just feel like a lot of these medications in our culture, our Western medicine, are massively overprescribed. And that's where, and maybe I'm on the other end of the spectrum. If it's a continuum, here's me all the way to the left, and here's Western medicine to the right. And so maybe the truth is somewhere in the middle, but I feel like a lot of that emphasis is over here. And just turn on the TV and look at the every third or fourth commercial is a pharma, okay, commercial for some kind of med. So, so here's society. they're not getting exposed to this knowledge, then you become what you hang around, right? So you this is how you the like the consciousness is over here. So maybe our job as healthcare practitioners is to, change that a little bit. I'm not trying to convert people. I'm just saying, like, I want them to say, all right, that kind of makes sense. Maybe I should look into that. It's all, it's not a religion. It's not a cult. It's just like, it's just logic. So, I mean, what are your thoughts on that?
Yeah, I think a lot of it comes down to common sense and good judgment.
Hmm.
So
Right.
if it's necessary for someone to take a medication in order to, live a healthier lifestyle, then absolutely. But a
Yep.
lot what goes on in the country is a lot of polypharmacy, where there
Hmm.
is too many medications being prescribed to patients. Now it all depends, right? Because some people that have diabetes, right? They will always need insulin, type 1 specifically, but type 2, they'll be prescribed metformin if their hemoglobin A1C is too high. That can lead to,
Yep.
worse capillary loss in the eyes or, diabetic neuropathy. And so that really needs to be addressed. But in terms of, you need to be more vigilant in what you're doing to help your disease get better, right? So sometimes a lot of patients will take a pill hoping that, okay, I'm good, I'm fixed. Like, I just need to take it every day. Well, that really isn't the point. I think the point is that the pill is helping you to get back that function in that short period of time so that you can really focus on changing your life so that maybe you don't smoke or you don't drink or you change your diet because a
Yep.
lot of this has to do with your lifestyle. And so when people are sometimes prescribed a pill, they think, well, I can keep up with my lifestyle,
Mm-hmm.
right?
Yeah. Right.
So they think, okay, I can take a pill. I'm just going to keep continuing to do what I keep doing. And so
Yeah.
that's what really happens. It just builds, 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 builds. And then another thing comes along, builds, 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 builds. And welcome to America. Welcome to
Mm-hmm.
America.
Right. And every medication has a side effect, some more strong than others. But you're
I
right.
mean,
I
you
think
can
it's
think
well
about,
said.
okay, but wait a minute. Let's think about there's a side effect with everything. There's a side
Yeah.
effect when I drink a cup of coffee. There's a side
Hmm.
effect when I go for a run. There's a
Right.
side effect when I go see my chiropractor. There's a side
Right.
effect with everything.
Right. Yeah. So I'd say, how about this? Every medication, many of them have some potential adverse side effects. So, and I think medications have their place. So what you said was like was well said. If it gets you on the road to be functional enough to find the solution, migraine headaches, great example. I've had patients that have taken, back in the day, used to be the injection of Imitrex, and then it was the pill. But guess what? Without it, they couldn't do anything. So gets them on the road, and then they're coming in the office taking the Imitrex, but then getting adjusted. So if it's a vasoconstriction, vasodilation issue from the upper cervical spine, I usually can help them, but maybe I can't. Depends. But at least it gets them functional enough. So again, everything has its place, and I have an open mind for that. I just see I see so many patients that come in and like 8 to 10 to 12 medications they're on, and they're not senior citizens. Some they may need, but some I feel like, okay, if your nutrition was cleaned up, or we could improve your functional range of motion and get you stretching, some of these meds you probably wouldn't need anymore. Not all of them, but many of them. And that's exciting when start transforming their life. And you're right, like you have somebody that's like type 1 diabetes, insulin their whole life, but it's okay, but they can still do things to nutritionally control their blood sugar levels. So it's good stuff. So what's my mission? Educate, inspire, motivate patients, and and tell them, okay, here's the other side of this. Have you looked at this? And then and show them that. And usually when you show them that, you get the confidence, like they're a little less fear driven of that out there getting me. It's pretty cool. So that inspires me.
Yeah, I think there just needs to be more education
Yes.
and a lot more needs to be done in terms of, looking at our own lives and seeing what can we do to make positive impacts.
Hmm.
Because if not, it will, it will bottle up to some point and you need to address it. Like you said with the billionaire is going to use all of his money in terms of surviving and make that money back, but you can't take it with you, and
No,
I
no.
think it's important that health is wealth. And it's important for our society that people live longer so that
Hmm.
future generations can learn from that. I wouldn't be the person I am without my grandparents. If they weren't
Mm.
in my life, I wouldn't be the person I am. So, this is what, society has always lived on. We've learned from our elders. We need our elders. The people that are veterans, that are struggling, people that are homeless. These are all
Mm.
real people's lives, and they
Hmm.
all need to be taken care of. So they all need to feel like, they're getting the help they need. And it really all comes down to their health. Is it their mental
Hmm.
health, their physical health, chronic conditions, disease management? And the
Yeah.
hospitals are being overflowed with the same stuff over and over again. And if we don't really focus on what's going on outside of the hospital, it will continue and continue and continue. So there
Hmm.
needs to be more done, in terms of that's why I believe nurse coaching is so powerful, is because people can be proactive and take action. Action is
Right.
everything. You take
Right.
action. You cannot be, complacent. You need to
Yep.
be doing, and doing is hard. Doing is not easy. You have to
Yeah.
work for it. But I mean, the flip side is you feel great. You feel like you're hitting all your strides, you're hitting your goals. And
Hmm.
whether that could be nutrition or your relationships or your
Mm.
career, or those are all the things that people get fulfillment of. And self-actualization, Maslow's hierarchy,
Right.
that's when they hit all those levels.
Hmm.
And health is the main one of the main foundations. You need to
Yep.
have your health in order. That's
Yep.
basic needs. And if that's not being met, you can wash everything out.
Yeah. And then when you're talking about health, we're talking about physical, emotional, and spiritual health. I think, I want to touch on spiritual health because to me, this is me. To spiritual health to me is connection with God. I believe there's a creator. I believe God created everything. He's running the show. I'm not. Do I have all the answers? I do not. But if I think that way, I also stay a little more humble. And that's also, for me, that's good. Overconfidence is good, but overconfidence is not good. I think
Yeah,
somehow
I would agree with
it's.
that. I'm a big believer in God. And
Mhm.
I've known that, as a young child. I was lucky enough to have my parents influence that in me.
Mhm.
So, knowing that you believe in something bigger than yourself, you have to
Mhm.
realize that God's given us all the tools to be successful and healthy. And
Yes.
so, relying on the mystery of knowing that God is watching out over you definitely gives you the hope and inspiration that you can achieve whatever you want in your life.
Yep.
I really think that people should get back into their faith, whatever that is. That could be Jesus, that could be, Hinduism, that could you could be whatever religion is, right? You need to really tap into that. And if you don't have faith, what do you have?
Hmm.
Faith is really what gets me every day, one day at a time. If I have a really hard
Yep.
day, I have to rely on
Yep.
God a lot harder.
Mhm.
And then, I also have to be thankful for the good days that God's given me, and I have to thank Him for that. So being grateful for every situation, like you said, being humble is so important
Yeah.
because that's what keeps going on to the next step and not getting too high or too low.
And then when you study the human body, as you and I both have, and physiology, you see that there's like this. The body has this innate intelligence within it. So where's that all coming from? I didn't create it. Like, sperm and an egg meet, they form a human being. All of this is like a miracle. The Earth orbiting around the sun, and like the balance within the solar system, and the balance within our body. There's a creator. I heard something the other day that was, and then I'm not trying to turn this into theology, But I heard something the other day, and the guy was saying, like, okay, he was talking to, I think, an atheist, and he said, like, okay, see, there's a painting on the wall of, like, over here. I have a painting of a horse, and he said, somebody painted that, right? It didn't just like pop out. Like, there's a creator, there's an artist that did that painting, and he said, there's a house over here. Did that house form itself, or did somebody build it? Yeah. So same thing with the earth and the world and the universe and us. Something created it. Did it start with the Big Bang Theory? Okay, maybe, but I still think there's a creator. So my belief system, but it is
Well, if
foundational
yeah.
for a lot of everything else I think.
Well, I think and this is even crazier. If you've ever really thought about how the body functions, right?
Mhm.
How is our heart getting that energy? You ever thought
I
about
don't
that?
know. Yeah.
I mean, that is
The
the
life
life
force, where's it coming from? Yeah.
energy,
Yeah.
energy,
Where's the
right? And
energy come
so,
from? Where's the
and
energy in the
you're
cell come
tapping
from?
into that. You're tapping into that. I mean,
Yep.
you really are tapping into that. And so that is really the foundation of everything created is energy. So getting that energy from your work, what you do, or your relationships with your friends or your wife, your husband, these are all things that are really giving us the frequency to really be our best selves. And it's all around us. You can choose good, you can choose bad, you can really choose.
Mm-hmm. Mm.
Decisions really make up our destiny. And so that's what I
Yep.
really believe in as well. You make the right
Mm-hmm.
choice, you make the wrong choice. It's going to
Mm.
be, and you have to live with that. And, I
Mm.
think that's what needs more in our country. We need to get back to our faith.
Yeah. Amen. Completely agree with that. So as we're talking about this, with our first podcast, I like to lay a foundation of intent. So my intent with this, and I'm going to ask you the same question in a second, but my intent is to, again, educate, inspire, motivate people about health and wellness, and then to with the other intent of like helping them reduce some fear, and then like opening them up to other possibilities. And some people have that, so it's
Yeah.
like expansive. So, and we're, as a community, the more people we help, or the more people we educate, teach a man to fish, so to speak, the more we're helping people. And I just believe, like, my side of the street is just do that and do a good job with that, and all the other magic follows. What about yourself?
Yeah, my intent is to really help people with their health and
Mm-hmm.
and really give them like you said, the inspiration that there are other, choices out there. Again, Western medicine is still a necessary thing, but I mean these other modalities such as, Eastern medicine or chiropractic, these are all really beneficial and proven to show that
Mm-hmm.
it does help. So I think, it's important that communities know that there are people out there that want to help and guide you in the right direction and give the answers that you're looking for within yourself. And only your body, your mind knows what's best for yourself. And asking
Yes,
the right people for help to guide you there it makes all the difference.
totally agree. So I have multiple topics I want to do in our future podcasts. Um, so you and I will kind of organize and coordinate that, but I'm excited about doing this in the future, and then sharing it with as many people as I can, especially linking it to some social media accounts as well.
Yeah, no, I appreciate you taking the time to do this with me. I look forward to doing many more.
Same,
I
same.
ideally would like to
I
do this
appreciate you.
weekly. Yeah. Well,
Yeah,
you're the man.
absolutely.
You're the man. I really appreciate you doing this with me, and inspiring more people to take more steps and being healthier with themselves and their lifestyles. And um, so thank you everybody for listening. We appreciate the
Thank you.
time. Please like, share, subscribe. Share this with people that you know that could benefit from this. So we appreciate your time and we look forward to the next episode. Everybody take care.